70 kilometers east of Jaipur, in the capital of the Indian state of Rajasthan, is the village of Barli. With a population of less than 1500, Barli represents a large chunk of the Indian population that continues to struggle with everyday needs. In the absence of the most basic medical facilities, locals are forced to run to the state capitals or the nearest metro for the smallest of problems.
उम्र है हमारी ये कम 70 का साल। घर में गाँव में खेती करते हैं जी, आपका परिवार ने पाड़ बाग ले, मतलब गाँव बाते हैं, गाँव जॉब बाते हैं, खेती करते हैं।
Lakharam is a community elder from Barli who has spent most of his life in the village, making ends meet through the land he tills.
मेरे शरीर में कोई तकलीफ है ये सोया डॉक्टर जी ये किया कि भाई वहाँ अच्छी जांच होती है, अच्छा इलाज होता है।
Last year he was diagnosed with heart disease. But lack of medical infrastructure in Barli means that he has to travel all the way to Jaipur just to get a CT scan done. Today, he's lucky to get a seat on the state transport bus. Sometimes he's had to travel on the roof just to make it in time for his appointment. Rural India has enjoyed few of the fruits of growth that India's burgeoning economy has thrown up. The country has some of the world's lowest ratios of doctors, nurses and hospital beds vis-a-vis the size of the population. What has not helped either is the low priority that healthcare has been accorded in the country's list of priorities. Tertiary care is often too expensive for people with low incomes. As a result, those with medical conditions often go untreated or are left with devastating hospital bills. But it is not all gloomy for Lakharam. A public-private partnership between Sony Hospital and SMS Hospital Jaipur means that he can get access to state-of-the-art medical care at virtually no cost.
SMS Hospital is the biggest hospital in our Rajasthan, and as well as it drains the patients from all over the North India. The surrounding states, all the patients are getting. The reason being that the good facility available here and all the facilities, these are available free of cost.
यहाँ पे हमारे 1957 बेडेड हॉस्पिटल है और हमारा एवरी डे का आउटडोर है वो है लगभग 10 से 12 हज़ार। हमारे यहाँ सिटी स्कैन पहले से जो गवर्नमेंट का लगाया हुआ था, तो ये देखा गया कि सिटी स्कैन एक मशीन थी, ओवरलोडेड रहती थी, ओवरबर्न रहती थी। फिर गवर्नमेंट के सेटअप में 24 आवर सिटी स्कैन रन करने में डेडिकेटेड मैन पावर राउंड द क्लॉक लगाने में वो प्रॉब्लम्स आ रही थी। तो ये उस वक्त ये प्रॉब्लम आने लग गई थी कि पेशेंट्स को बाहर जाके सिटी स्कैन कराना पड़ता था। तो ये विचार आया कि इसको पीपीपी मोड पे वर्कआउट किया जाए। अब हमने 2 सीटी स्कैन और 2 एमआरआई लगा रखे हैं जो पीपीपी मोड पे हैं और ये पीपीपी मोड बड़ा सक्सेसफुली चल रहा है।
I have a knowledge of private health care at nursing home level, at corporate hospital level, health education level, and now the PPP model. Looking into all the aspects and the way the health sector has been neglected by the government in infrastructure development, in education, I think PPP is the only solution. Any corporate hospital, may it be Apollo or anything, they would have to bother about patients coming. They would have to bring in doctors who will bring patients. Here the patients is automatic flow. We need good doctors to give services. We need good infrastructure and good equipments. So it's a very good relationship of infrastructure available free and patients available. What private has to give is decoration of the infrastructure by way of best equipment and best of the doctors' availability by way of treatment.
See, this is a center which is running in PPP, which is public-private partnership, and public-private partnership is actually a good way in which people are combining two things. One is basically the mass volumes that are available in government, with the operational excellence that can be bought in by a private player. And the idea of this kind of a public-private partnership is that this is essentially something which is a bottom of the pyramid in innovation.
This is quite an achievement, for when it comes to serving the poor, the returns are invariably too low or the effort too high to interest mainstream businesses. The need for a value-based approach that sees revenue generation as a means and not as an end is something that this partnership has been able to address quite successfully.
There's a lot of advantage with the private partnership. First, the government has not to spend money, and by the private partnership, we are able to install the high-end machines very easily. First thing. Second thing, we are getting the round-the-clock the services from these CT and MR, and simultaneously we are getting also the 30% patients free of the CT MR from whatever the patients they are doing. And the rates, whatever other 70% are giving, that rate is too low.
उसका हमारा जो फ्री पेशेंट करने हैं, BPL सारे पेशेंट फ्री करने हैं उनको, सीनियर सिटीजन फ्री करने होते हैं. सीनियर सिटीजन मीन्स अबाउ 60 ईयर्स ऑफ एज. विडोज़ हैं वो फ्री करने होते हैं, और हैंडीकैप्ड हैं उनको फ्री करना होता है.
Unlike Western world, we are doing approximately 400 CT scans a day on a daily basis. Whereas this is typically the volume that you would observe in a single CT scan in a whole month. By having more volumes, we have been able to cut down the cost of a CT scan, which is normally $1,000 per scan, to a mere $11 per scan. And for a MRI, which is again a very expensive test, to a mere $40 a scan. This is true innovation to bring the people into the healthcare systems who were completely out of it. If I look at our paying customers, they are paying $11 for a CT and $40 for an MRI. Even they are able to get the best technology in Rajasthan at an affordable cost. In financial year 13-14 alone, because of the extremely high volumes, we did more than $1 million of free scan. And this year we are set to exceed that. We would probably do about $1.2 million of free scan this year. And last year alone, we gave approximately $500,000 to the Rajasthan Medical Relief Society, money which they use to further treat poor patients, because that is where Rajasthan Medical Relief Society works. So whatever that we earned in this center, we gave much more than that to the society, to the people.
A visit to the hospital's CT and MRI suites, located in the emergency and OPD wings, is a worthwhile experience. Here one can witness how a well-planned infrastructure facility and its effective utilization can result in the efficient management of very large volumes of patient inflows without any compromise in the quality of work and individual patient care.
In Jaipur, SMS Medical College, the 4 CT and MRs which we have put, everybody in town knows that if you want the best of the CT or MR, go to SMS Hospital. If you have to do a coronary angiography, which is done in 15,000 outside, and we are doing it at 3,500, people are coming. So, and with the best of the machines.
I think we as a faculty member are very happy with the Sony CT Scan Center. A, it is providing the round-the-clock services. B, immediately our needs are met out of investigating patient. C, the reporting is very prompt and qualified radiologists are reporting it very nicely. And lastly, they also have the very high-end equipment. So basically, it is a great asset to all of us.
Our record on the Limca Book of Records is approximately 239 CT scans in 24 hours, which boils down to roughly 1 scan in 6 minutes. Therefore, it is very important that we have a process in place where a patient can come in, get his scan done, get all his work done, and be out within a span of 6 minutes. And we have got the best of doctors in town from all the NABH internationally accredited hospitals in town. And they are the ones who come here. And if you look at the number of cases that we are doing on a daily basis, 500, our error rate is very low. We get less than 1% cases for review. And this is because we are using the best doctors in town, combining them with the best typists and paying them the best salary.
Such public-private partnerships are a win-win for all stakeholders. For private players, the program can increase the number of patients and potentially widen the client base, thereby allowing for economies of scale. For patients, especially the lesser privileged ones, good quality medical care is now available at affordable prices, and that too with minimal waiting time.
इन्होंने जो डेवलप किया है यहाँ पेशेंट का वेट के लिए जो स्पेस प्रोवाइड किया है वो एनवायरनमेंट सूदिंग है, एयर कंडीशनड है और पेशेंट वहाँ पे पेशेंट और उसका अटेंडेंट को ये फील नहीं होता, वेटिंग पीरियड भी उसको बड़ा नहीं लगता क्योंकि वहाँ इन्होंने टीवी और ये सब तरह का एंटरटेनमेंट का, उसके पानी का वो सारा व्यवस्था करवा रखी है, तो उससे काफ़ी फ़र्क पड़ा है।
डॉक्टर साहब ने बोला कि इसमें एमआरआई अच्छी रहेगी, जांच अच्छी रहेगी, इसके अंदर सब मालूम पड़ जाएगी क्या है क्या नहीं है। मतलब यहाँ पर पैसे कम खर्च होते हैं और यहाँ पर अच्छे डॉक्टर की सुविधा उपलब्ध है, इसीलिए हम यहाँ पे आए हैं। यहाँ पर अच्छा स्टाफ है, अच्छे डॉक्टर हैं। हमारा एमआरआई फ्री है क्योंकि हम बीपीएल कार्ड के संबंधित है, इसलिए एमआरआई फ्री होगी यहाँ पर।
Actually, I had a cyst over here and I was concerned whether the cyst is malignant or not. So I had asked the doctor, Dr. Shashikant Jain. So he had recommended me here that the services are good and he was satisfied with the report that would come out. So instead of going to a private center, he asked me to come here and get the CT scan done. First of all, I was surprised by the rate that the registration part, it was just ₹5. And then even the cost of CT scan. I mean, I would have paid at least 5,000 to 6,000 maybe outside in a private hospital. Here it was 1,000, which was like, that was surprising for me.
I think there could not be a better center than our medical college hospital center for training. You will see the volumes of patients, number of patients. I think the number of variety of the CT reports or MRI reports or the differential diagnosis you see in this hospital, I don't think you can see anywhere else. And it is a variety of the reports, variety of the patient, which is the best source of the wonderful training. So I think there could not be any better institute than this institute for training purpose, and I'm sure it is a very wonderful for our upcoming residents.
हेल्थ केयर सेक्टर में ये जो मॉडल है SMS का, CT MRI का, ये मॉडल तो ग्रैंड सक्सेस रहा है।
As India seeks to become a global power, there is perhaps nothing more important than the health and well-being of its citizens. But given the wide gap between demand and supply, public-private partnerships provide a crucial lifeline for India's poorest who can barely afford food, let alone hospital treatment. Philips Healthcare has stepped up to the challenge and is committed to making a difference. Doing something that's far from easy given the magnitude of the task ahead. The climb is uphill, but the impact on people's lives makes it all worthwhile.
Philips made it viable by bringing in the best of the technology and at a cost which they would normally have not given to ordinary private players. Since it was happening in a government hospital, they found that this would become as their model center, which they were right.
So PPP is a great way to bridge the 50 years of legacy of social medicine that has been happening in this country, and while not fully privatizing it and taking it to very high rates, but rather bringing in the best of both worlds to generate truly bottom of the pyramid innovation and excellence.
Ultimate winner is the patient. Definitely the patient who is getting the benefit, who is getting the modern facility at very low cost and the very good treatment.
PPP मोड का अल्टीमेट विनर है स्टेट की पब्लिक।
I think at the end of the day, the biggest winner in this situation is India and the people. Because this is an innovation which is pioneered in India. This is something truly and uniquely Indian. And the benefit has been our Indian patients and our Indian people only.
Philips Healthcare, making a difference.